If you've just had a face and or a neck lift, or you're about to sign up for either of those procedures, these are the medications that we will be prescribing you. So first things first, let's talk about the medications that you ideally start the night before your procedure. So the first medication will be your antibiotic. Ideally take that with dinner the night before your procedure. The next medication that we'd like you to start beforehand is something called tranexamic acid. This is for bruising specifically. Take that as well. You can take it together with your antibiotic with dinner the night before. The third medication is a nice to have, not need to have. It's a homeopathic medication called Arnica. It's very good for inflammation and bruising as well. Not all pharmacies have it. So if your pharmacy did have it, you could take it the night before. If your pharmacy doesn't have it available, you can pick it up at a health food store. That being said, it's a nice to have, not a need to have. So nothing to eat or drink the morning of your procedure, but do bring all of your medications with you to the surgical center. Let's talk about pain control after your procedure. Most people do really well with pain after a face and neck lift because most people are actually rather numb after a procedure like that. So most people do really well with just two medications that we prescribe called Tylenol and Celebrex. Tylenol you can take every 4 hours, while Celebrex you can take twice a day. For breakthrough pain, we will also prescribe something called tramadol if the Celebrex and Tylenol combination isn't enough. Now, in order to manage swelling, we prescribe a 5-day course of prednisone. This is a steroid that you take once a day to help keep swelling and inflammation at bay. Now, some patients get post-operative nausea, and for that we recommend picking up Gravol, which is an over-the-counter anti-nauseant, but we will also prescribe something called ondansetron, which again is just a pill form anti-nauseant. It's very strong and very effective for post-operative nausea. Something else to manage post-operatively is bruising. So for that, again, there's two medications. The tranexamic acid that you would have started the night before. Ideally, you take that 3 times daily for 5 days post-procedure. And you can also take your Arnica tablets, if you have them, 3 times daily for bruising. Of course, to mitigate infection, we also prescribe you a short course of antibiotics that you take twice daily until they're gone. So those are all of your medications. For pain, we prescribe Tylenol and Celebrex. Celebrex also helps with swelling. For breakthrough pain, we prescribe tramadol. For further swelling control, we prescribe a short course of prednisone. Also a short course of antibiotics to mitigate any infections. Then for bruising, there's the prescribed tranexamic acid and optionally Arnica pills if you can find them. And then the very last but not least is the anti-nausea medication called ondansetron. That's only necessary if you have post-operative nausea. Of course, reach out with questions or concerns about your medications pre or post-op. We're always happy to help.